This training serves as the required annual update on common school health-related topics, including bloodborne pathogens, first responders in our schools, diabetes, medication, and common health conditions such as asthma, seizures, and students with anaphylaxis. Copies of the Franklin County Schools Bloodborne Pathogens Exposure Control Plan can be found in each school's main office, in the school nurse's office, and at central office. The plan identifies job categories that may be at risk for exposure to bloodborne pathogens, what constitutes an exposure, how to prevent exposures, and what action to take should an exposure occur. Lisa Purcell Morris is the Bloodborne Pathogens Coordinator and is available to answer questions related to bloodborne pathogens. Bloodborne pathogens are organisms that are present in human blood. These organisms can cause diseases such as hepatitis B. Hepatitis B affects the liver. The damage done by this virus can lead to permanent liver damage and liver cancer in some people. Hepatitis B is 100 times more infectious than HIV, and in a dried state may remain viable on surfaces for up to 1 week or longer. Risk most often occurs through unprotected direct or indirect contact with infected blood. Hepatitis B is the only blood-borne disease with a vaccine available to protect against transmission. Hepatitis C also affects the liver. Many people show no signs or symptoms with this illness. Injection drug use is the primary risk for hepatitis C infections, but it can also be transmitted through razors, needles, toothbrushes, tattooing equipment, body piercing equipment, etc. HIV is the virus that causes AIDS. AIDS weakens the body's immune system so that it cannot fight other deadly diseases, eventually leading to death. The HIV virus does not survive long outside of the body. People providing first aid or medical care involving fresh blood are most at risk. People infected with any of these diseases may not show signs or symptoms for months to years after becoming infected. That is why it is so important to use universal precautions. This means treating all blood and body fluids as if they are infected. Gloves should always be worn during contact with blood or any other body fluid, such as urine, feces, or vomit. If someone is injured, always take the time to put on gloves before assisting with care. Hands and other parts of the body should be washed immediately after contact with any body fluid, even if you wear gloves. Surfaces soiled with blood should be disinfected appropriately. Please call a custodian for assistance. There is a vaccine available to prevent hepatitis B. It is a series of 3 shots spaced out over about 6 months. Franklin County Schools offers vaccination to employees identified as at risk for exposure to bloodborne pathogens. At-risk employees means employees identified as being at risk for occupational exposure to blood and other potentially infectious materials due to the daily nature of their jobs. Examples of at-risk positions are nurses, first responders and diabetic care managers, and our custodial staff. Anyone could potentially be at risk for exposure to blood, so vaccination is recommended for everyone. The vaccines are covered by the state health plan and can be given by your primary care provider. Other ways to protect yourself include placing all needles in sharps containers located in the nurse's office at each school, using a dustpan and broom to clean up broken glass, covering all open wounds with a Band-Aid and encouraging students to cover their open wounds as well, using personal protective equipment such as gloves. Other personal protective equipment such as gowns and masks are kept in the nurse's office and should be used when there are incidents where a large amount of blood is present. At the start of each school year, nurses give our school staff gloves and Band-Aids, and if you need a refill of these items, please make sure to contact your nurse. Exposure at work can occur from direct or indirect transmission. Direct transmission is from one person to another via an open cut, abrasion, sore, or mucous membrane. Indirect transmission is touching a contaminated object or surface. Remember, hepatitis B can live on surfaces for up to a week. That is why it is so important to cover wounds to prevent blood and body fluids from getting on surfaces and to call a custodian to help clean up areas that become soiled with blood. If you do have an exposure to blood, please make sure you wash the area immediately with antibacterial soap and running water. Report the exposure to your supervisor and the bloodborne pathogens coordinator. You will be asked to complete an exposure report form, which is located in the red Bloodborne Pathogens Exposure Control Plan in each office, as well as workers' compensation forms. The completed exposure report form should be taken with you to the approved Franklin County Schools provider for post-exposure medical evaluation. Because our schools do not have full-time school nurses, each school has 2 staff members that serve as first responders and diabetic care managers. These staff members are trained to respond to a medical emergency if the school nurse is not on campus. Please make sure that you know who your first responders are and how to contact them in the event of an emergency. First responders do not receive training for and should not be used for non-urgent or emergent issues. A non-urgent issue would be a student who is having cold symptoms or who has an injury from home. If it is truly an emergency, you should be calling the first responder to your location. Each school also has an automatic external defibrillator. The AED may be needed during CPR to help save someone's life. Make sure you know the location of the AED in case you are asked to get it during an emergency situation. AEDs are designed to be very easy to use. If you are interested in learning CPR and how to use an AED, please contact your school nurse for information on available classes. Per Franklin County Schools Policy 6125, Distribution of Medication to Students, all prescription medications must have a medication authorization form completed by both the healthcare provider and the parent. There are no exceptions. Over-the-counter medications in grades K through 5, or any over-the-counter medication that needs to be administered by staff, also needs a medication authorization form completed by the healthcare provider and the parent. All medications should be brought to the school in the originally labeled package by a parent or other adult designated by the parent. Medications may only be administered by trained Franklin County school personnel. Medications should be stored in a secure location. If you have a student who needs medication administered during the school day, these are the 6 things to remember. The right student gets the right medication in the right dose, at the right time, via the right route, and that it is documented the right way. All 6 rights must be present to properly administer the medication, or a medication error has occurred. Any medication error must be reported immediately to the nurse, principal, and parent. Once the nurse is notified of the error, she will assist you in documenting the error on an incident form. Once the parent brings the required completed forms and properly labeled medication to the school, the nurse will review the order and prepare the medication log. The nurse will give you the completed log, which has the instructions for how to give the medication written on it. Always follow the written instructions and verify the 6 rights each time you administer the medication. If anything is different between what the label on the bottle says and what the nurse has written on the log, always stop and contact the school nurse for further instructions. If medications are to be given in the main office, please send the student at the designated time to receive his or her medication. The office staff may not be able to call the student down, so your assistance in getting them to the office is needed. Always remember, if you are administering medication, to never directly touch the medicine. Put the pill in the cap from the bottle or in a cup for the student to receive it. You want to document after the medication is administered and not before, in case the student refuses to take their medicine. If they do refuse, you need to document that they have refused and notify the parent or guardian. Medications can be given within a 30-minute window. That means if the medicine is due at 12:30 It can be given any time between 12 and 1 o'clock. If a student with medicine is having any type of behavior changes or any other issues, it is always important to notify the school nurse. This is the logbook that the nurse will give you for documenting daily medication administration. It is important to remember that this is a legal document and should only be completed in black or blue ink. The information at the top will be completed by the nurse based upon the written instructions from the healthcare provider. Documentation should occur immediately following medication administration. On days when medication is administered, the person who is administering should write their initials in the box for the appropriate date. There are codes at the bottom right to be used on days when medication is not administered due to absence, early release, etc. There should not be any empty boxes on this documentation form. The nurse will monitor the document for accuracy. If you have questions, please don't hesitate to ask. Some medications may be self-carried by our students. North Carolina law allows emergency medications to be self-carried. These may include inhalers, EpiPens, and diabetic medications. In Franklin County schools, students in grades 6 through 12 may also self-carry over-the-counter medications with written parent permission and non-narcotic prescription medications with physician and parent permission. In order for a student to self-carry a prescription medication, the student's healthcare provider and parent must document that it is acceptable on the medication authorization form. The school nurse will meet with the student and complete a self-carry contract that ensures that the student is knowledgeable about the medication and their responsibility in carrying it. The school system assumes no liability for students who self-carry medications. Some important things to remember about medication administration. Only medications that meet the requirements in Policy 6125 and have been checked in by the nurse may be administered. You should never allow students to share their medications, and you should never give a student any of your personal medication. If you are uncertain, always stop and call the school nurse. If you see a student with medication that the nurse has not notified you about, always contact the office and the nurse. The nurses will meet with teachers individually on specific students as needed. North Carolina General Statute 115C-375.3 mandates that all school personnel have general diabetes training. It also requires that each school have at least 2 staff members that are intensively trained in diabetes care if there is a student with diabetes enrolled. The staff that are trained as diabetic care managers at your school are also your first responders. Make sure you know how to contact the first responder/diabetic care manager in the event of an emergency. Diabetes is a serious chronic condition that impairs the body's ability to use food. Insulin, which is a hormone produced by the pancreas, helps the body convert food into energy. In people with diabetes, either the pancreas does not make insulin or the body cannot use the insulin properly. If you have a student in your class that has diabetes, the nurse will provide you with a plan outlining the student's specific symptoms of high and low blood sugar, as well as instructions on what accommodations the student may need. This plan is developed by the nurse, parent, student, and healthcare provider. It is important to remember that students with diabetes are allowed to carry their supplies with them at all times. They may check their blood sugar anytime they feel symptomatic and have a snack when needed. Some students may demonstrate skills and proficiency to provide their own care, and others may need assistance from a diabetic care manager. High blood sugar is also known as hyperglycemia. Typical signs of hyperglycemia may include extreme thirst, hunger, frequent urination, blurry vision, drowsiness, and dry skin. If you have a student with diabetes who is complaining of symptoms of high blood sugar, always follow their diabetes plan. Often students can remain in class with a high blood sugar, but may need to drink extra water and use the restroom as needed. Low blood sugar is also known as hypoglycemia. Common symptoms are shaking, feeling anxious, sweating, feeling dizzy or having a headache, drowsiness, fatigue or weakness, hunger, and irritability. Always follow the diabetes care plan. Treatment may include checking the blood sugar and giving the student a snack or drink. The student will need to recheck their blood sugar to make sure that the further treatment is not needed. Never send a student that you suspect may be having a low blood sugar to the office or diabetic care manager alone. Always request that they come to you. A severe low blood sugar can lead to unconsciousness, seizure, and death. Low blood sugars can quickly become a medical emergency. The easiest way to prevent this type of emergency is to feed the person. Remember, loss of consciousness is a diabetic emergency. You need to get help immediately. Call 911 and stay with the student. Call for the nurse and diabetic care manager, as the student may need an emergency injection called glucagon, and contact the parent or guardian. One of the most common health conditions in school-age children is asthma. It is important that students with asthma always have their emergency medication, which is also known as a rescue inhaler, easily accessible. If the student is competent, it will be their responsibility to have their inhaler with them at all times. Students that have not demonstrated competency to self-carry may have an inhaler that is kept by school staff. If you have a student in your classroom that needs an inhaler, always make sure you take the inhaler with you every time you leave the classroom. Students who need an inhaler at school should have an emergency action plan. This plan will be shared with you by the nurse and contains important information about what the student's specific signs and symptoms are and what may trigger them to have an asthma attack. It also gives instructions about the student's medication. If you are asked to help a student administer an inhaler, the nurse will give you a log to document the medication administration on. Another common health condition is seizure disorder. Students with seizure disorders should have an emergency action plan that will be shared with you by the school nurse. Make sure you review the plan so you know what to do should a seizure occur. A few basic things to remember. Always note the time the seizure activity begins. Timing is important. Some students may have emergency medication that is given for seizures that last a certain amount of time. The time is also important in knowing when to activate EMS. When an emergency situation occurs, perception of time may be incorrect, so having someone time the event will ensure accuracy. Call for help. Ask for the nurse or first responder to be sent to your location. Try to protect the student. Move desks, chairs, or any other hard object out of the way. If possible, place something soft under their head. Never try to put anything in their mouth. Each student's plan will be individualized, but a general rule is to call 911 if the seizure lasts for more than 5 minutes, or if this is the student's first seizure. The last common health condition that we are going to cover is severe allergy, also known as anaphylaxis. Many students are allergic to various foods and insects. Some of these allergies may be severe and may impair the student's ability to breathe. Students with severe allergies may have emergency medication, commonly known as EpiPen, at school to treat a potential severe allergic reaction or anaphylaxis. Every student who needs an EpiPen should also have an emergency action plan detailing what they are allergic to, what their specific signs of anaphylaxis are, and how to treat their symptoms. The school nurse will share this plan with you, and if the student is not competent to self-carry their medication, the student will show you how to administer the medication. Some of the most common symptoms of anaphylaxis are tightening of the throat, a hacking repetitive cough, shortness of breath, wheezing, swelling of the lips, tongue, or face, and widespread hives. Many people may have an undiagnosed allergy. Anaphylaxis can progress very quickly, so prompt treatment is important. North Carolina legislation requires all schools to be prepared to respond to an anaphylaxis episode at school-sponsored events on school campus. Every school has 2 doses of epinephrine available to be used in the event of an anaphylactic reaction. Students who have known severe allergies must continue to bring their own emergency medication and comply with the FCS medication policy and should also have an emergency action plan. There are staff trained at each school in the administration of EpiPen. Each school administrator has a list of staff trained in EpiPen and CPR. Please locate the bright yellow box on your campus so that you know where the EpiPens are kept in the event that you are asked to get them in an emergency situation. This concludes the required training for bloodborne pathogens, diabetes, medication, and common health conditions in the school setting. If you have any questions, please contact your school nurse. Please be sure to return to the previous page and click the acknowledgement of completion in order to receive course credit. If you are completing this training pre-employment with Franklin County Schools, you will need to complete the Google form in order to receive credit. Thank you for all you do for the students of FCS and have a great year.